All right. So,
Yeah, better. Okay.
welcome, Dr. Hoelscher. So, you hear me okay? Sound is okay?
Yeah, I hear you. Thank you.
All right,
Great.
perfect. So, I just want to introduce with few,
You hear me okay? Sound is okay?
I just want to introduce here with few words. Dr. Hoelscher is a general practitioner in Witten, Germany, which is close to Stuttgart, right? And he's practicing also Chinese medicine, acupuncture for many years, and also hunyuan medicine for a few years. And last year, I asked him, because in hunyuan we always want to find out what else is out there that is at least in line with our philosophy, being more about happy, healthy, and long life, and not just about selling procedure. So Dr. Hoelscher was on the mission for the last year to find out all the holistic and beautiful things that modern medicine has to offer. And I think he got very much enlightened by it. So I want to invite you here, Dr. Hoelscher, to speak about your experience, what you found, what you think, what you use in your clinic, and help us out here a little bit. So.
Yeah, thank you, Jan. Thank you very much. Yeah, exactly. It was yeah, quite funny because I didn't really plan to look into modern Western medicine research so much, yeah, because I'm busy, of course, with my hunyuan patients and also Western medical patients who see me as a general practitioner, so there's a lot to do. And I always had quite clear what I could do with Western medicine and what I couldn't, yeah. But I wasn't so open to the idea that there were some, yeah, I mean, there was new stuff going on there, that there were new methods to be tried out that were in line with my kind of thinking, yeah, because there are some new guidelines every few months, but they mainly stick to the old paradigm of how we look at health and disease, yeah, and nothing really new was found for me there. So, but I'm lucky, I'm happy that I did dig in a bit deeper, and there is basically quite a new way of thinking and looking at health. Yeah, this is what I would call it, and it's and that is emerging, and this has really it's a movement. Yeah, like in its beginning, and it's a really exciting time. It's a really exciting movement, and I would try to compare it. When we look at what Western medicine, conventional Western medicine does, it's often like we stumble backwards from the disease. Yeah, we out of fear from disease, we like stumbling backwards. Yeah, so this is also what research shows. There was research like in the 50s that cholesterol, yeah, rises your likelihood to get a stroke or heart attack. So everybody was like stumbling backwards from cholesterol, yeah? And in a quite, yeah, I mean, in a quite narrow, single-minded, narrow-minded way. Like, okay, if cholesterol is bad, we should cut out cholesterol. Yeah, so easy. Yeah. But when you really look deeper in the research, you see cholesterol is a problem, but eating high cholesterol products does not raise cholesterol. This is not proven as it was, I mean, stated by many institutions. Yeah, not that this link isn't so clear. Yeah, so. So in this manner, in many fields of Western medicine, another field where it's very prominent is like the germ theory, and like we have a germ that causes pneumonia. And of course, if you have a severe pneumonia and you are about to die, it's great to have an antibiotic by hand and give it and survive. This is really, I mean, wonderful drug if it's really needed. But in the same way that we said, I mean, like cholesterol is bad, we started saying, okay, like germs are bad, yeah, the bugs are bad, so we have to fight them off. And in Germany, I don't know how it's in the US, you have like a lot of advertisements where you can buy stuff to sanitize your hands and everything like this, yeah? So, and it's always like stumbling backwards from disease. And what I see now is a movement that tries to turn around 180 degrees and run toward health, yeah? And so let's see what comes out of this, because if you always stumble backwards and treat like cholesterol and take an antibiotic for everything where we are not so sure, it may be in bacterial infection, but maybe it's not, but better how you say it, better err on the side of safety and give an antibiotic, we do cause quite a lot of harm in the patient. Yeah? And this is coming clearer and clearer now. And the research was there for quite some time, but people didn't really care, didn't really dare to look at it, what it really meant. And this is what I feel is changing a lot. Yeah? So at the same time, what research is proving more and more is that traditional lifestyles, I mean, okay, I take another angle. What happens now is that we do not only study disease, but we start studying health as well. Yeah? So there's something that's called blue zones, where statisticians, I think that's the English word, found out, okay, we have like populations, very diverse, some in Greece, some even in the US, where people live from a certain religious background, where people get quite old in a quite healthy way, because only getting old can't be the objective. It has to be with some health attached to it, so you can really enjoy your life. And this is very interesting to look at these populations and see, okay, what differs in their behavior from what the rest of the country, the rest of the nation do. For example, in Greece, there's this island Ikaria, I think it's called, and people are getting quite old there and quite healthy also. And when you look at what they do, it's nothing so really fantastic and nothing so really exciting, but they have like a simple lifestyle. They spend a lot of time outside. They have their own gardenings. They go fishing. They eat fresh whole foods. They meet in the village to drink some wine and have some company and dance and listen to music. So lastly, it's a bit reaching for the low-hanging fruits. So we don't always need the special power drug. I mean, this is what we got accustomed to over the last 50 years. That medicine always discovers another field, another drug, and of course, this is human nature. I mean, can't I just go on like this and take this new drug or this new pill or even this new supplement, which might help, but might also bring no benefit at all. So, so we are so accustomed to go in this direction and look for something out there. And often the solution to a lot of health problems we see right now, or I see with my patients on a regular basis, the solution is very close. The solution is, I mean, really, when do I go to bed? Or how long do I stay up with Facebook or Netflix or anything like this? How do I sleep? When do I get up? How much sunlight I am exposed to? What is my diet like? How do I move? I mean, all these things, and this is very funny, are accepted as a cause for disease. I mean, everybody knows, and it's written in every newspaper, that modern diseases are lifestyle diseases. On the same time, it's not accepted, neither by the practitioner or physician, nor by the patient, that lifestyle could be the change, it could be the solution, could be the healing method. So, and this is changing, I feel, and there are some, especially in the US, but also in the UK, mainly some experts really promoting this and getting quite good results, and I have seen it with my patients also, that very small changes in lifestyle can do really great, I mean, changes in their health.
But let me ask you a question. I mean, we actually in the academy today, in the class I had earlier today, I was talking about medicine versus market economics. In other words, when you have market economics, it's like what buy, what sells, what customer wants, and what do we sell them. All the things that you're saying, which is very much in line with hunyuan, is like against market economics, is like helping people, but it's all for free, do it yourself, you can't sell it. So in your research, like, what did you find about all these people that want to change the trend? What do they do about that? Like, you teach people, it's hard to sell them anymore. They're like, you change your diet, you change this, you become healthy, you don't take the pills. Where's the business? Which, again, not that I'm criticizing it, but it is a part of the problem. This market economics, we want to make money with medicine, and now, like you're suggesting, and we agree in hunyuan, health belongs to the people. It's not always you sell it. It's like you kind of make it yourself. So like is there any change in the trend of many modern medicine doctors that says, no, we want to empower people and not just sell them?
Yeah, exactly. I mean, this is what, I mean, most of those people promoting this are doing. I mean, they're writing books, they're having blogs, they're having podcasts. I mean, I could shut down my clinic for the next 5 years and only listen to all these podcasts and read those books. Yeah? I mean, there's so much knowledge already out there. And it is exactly what you're saying. It is empowering the patient. Yeah? And I mean, from the business model, what I like very much is, this is an idea from one US physician. He rented a town's hall and invited all people who were interested and said, okay, what is it that you would want from a physician? Yeah? And they really told him, oh, I would want like this. I mean, from a general practitioner, what would you expect him to deliver? And they told him, yeah, what they wanted, and then it was a woman, and she said, okay, but would you be willing to pay for it? And they said, yeah, of course we would. And then they made like a membership model. Like, okay, you pay like $150 every month. I mean, for 2 years or something, so I can do the calculations, and then you can come as often as you like. Yeah, because this would be a good model for providing health. Because people have to pay every time they come. They come once and talk to you about nutrition for a lot of money, and then they don't come back with the question because it's costly. Yeah, so right. I mean, this would be a very nice model, for example. But I mean, that's very, I mean, the doctor, the term, if you translate it, it's teacher. Yeah, so this is what the word itself means and what it should be. And I mean, this is what I'm doing also all the time. The question is, what is the quality of what I teach? Yeah, is this what I teach? I mean, just telling the people you have to eat less and move more. I mean, people are told this for 50 years, and I mean, you see the overweight, obese epidemics in the whole Western world. Yeah? So the advice has to be good, and you have to basically implement a coaching schedule. Yeah? You have to work together with a health coach who really takes people by the hand and teaches them how to do it. Yeah? And they did it in Colorado. That's all they did. Yeah? They didn't hire any physicians. They took a group of health coaches and invited people to come in and taught them about nutrition, about movement, and about sleep, and just saw, okay, how will this impact their health? And there were quite big results, quite good results to this.
So is what, from your finding, is this like an individual that just want to break through the system, or is there any kind of trend that you can put all these people together and says in Western medicine there's actually a new trend, or it's just like individual people who got enlightened and do their thing? Like, what do you think?
Yeah, it is individual people. I mean, it is a movement. Yeah, I mean, basically, those people who are leading this movement are mainly, yeah, they had relatives who suffered, or they suffered themselves of a disease where conventional Western medicine couldn't provide any solutions. Yeah? So, and they went on different roads to find their own solution, and were successful and really promoted the way they found. I mean, there's one from New York, I think. He's a physician. He was diagnosed with type 1 diabetes in the 50s, yeah? And he went to be an engineer and started to buy his first own machine for checking blood glucose, and he started to get himself better and better and better, and he had really good result, and he had some people he coached also, but nobody wanted to listen about it. All these diabetologists, they didn't want to know it, so he started studying medicine on top of this. Yeah, so he had a second career, and he's now very, I mean, he's one of the real experts in diabetes. But I mean, this is like running against the stream, really. Yeah, it is. I mean, the Western medicine, conventional medicine establishment does not really buy into it. Yeah? I mean, they don't want to know about it. So there is some. I mean, it's mixed. Yeah, I mean, the recommendations on how much fat we should eat and could eat, they are changing because evidence is so poor that we should avoid fats, for example, like good fats like butter and coconut oil and olive oil and things like this. So there is change coming, and this movement, as far as I can see, is really gaining speed. I mean, they sell books, and they are sold, I mean, also in Germany, quite a lot of numbers. So people, often when I do recommendations on on food myself. People say, "Oh, I saw this on TV," so it's a movement coming. I'm quite sure about this. But the medical establishment is not necessarily involved in this. Yeah, it's more patient things that's coming.
Well, but from my experience, I see sometimes like when people try to break out of the box and say, you know what, I don't want to give so much drugs, I want to do diet or something. Let's say a Western doctor, a modern doctor. Oftentimes there's quite a bit of a stiff resistance there. Like people will start to point him out within the medical industry. They're going to say he's an outcast, you know, a doctor who turned acupuncturist or some weird stuff. Is it like in your research, is it becoming less? Is it becoming more? Because it used to be like this, that if you go out of the box, you're like an outcast. But is it like becoming more accepted? What do you think?
I mean, difficult to say. Basically, what I see is that a lot of the research is quite good, and the concepts behind it are also so logical that also, I mean, the physicians I talk to are open to the ideas, yeah? But being open to a new idea and to really promote it and to change your clinical practice is quite a step, yeah? Because you have to, I mean, for example, with diabetes, yeah? It's so easy to, I mean, you tell the patients for once, okay, you should try to change your diet and you should try to lose some weight. And then they come back like 3 months later and they say, okay, he couldn't do it, so here's the drug. Yeah? So I think the big change that has to happen, and this of course needs, I mean, this leads that to the fact that you have to change your clinic, how you operate with patients, how you teach them, how you interact with them. Yeah? And this for many physicians, I think, is quite difficult. But then how you look at the disease really changes, and it changes into, I mean, we have this model like we have one disease and we have one cause, or oftentimes no cause. I mean, there's so many diseases where there's no cause, or the diagnosis is just your blood sugar is too high. And then we try to have one fix, one cure, one pill, one intervention. Yeah? And this really can't solve the problem when the problem is based in so many different, I mean, there are so many different causes, for example, with diabetes. Yeah? So there is a lack of movement, there is, we eat too much, I mean, carbohydrates, we eat it too often, it's a time frame in which we eat and so on. So, I mean, when you embrace those concepts, you really have to change how you work with a patient. And this is basically the problems involves much more time. Yeah? I mean, in order to get a bond to the patient, and in order to really bring him into changing his behaviors, his lifestyle, you need more time. And this is the problem I see most. Yeah? So I see a lot of physicians who say, okay, great idea, and oh, I would love to do it, but they can't really find a model where they can put so much time with the patient in.
And let me ask you that also in this respect, you know, because I mean, some of it is like you need to change the model, but how much like freedom do doctors, you think, have to do what they want? Like I just can think of one case where I talked to a professor from Stanford University who's a practitioner, a Western doctor, and we were talking about doing this prostate cancer exam. And he said, I'm just repeating what he told me at the time, we had that discussion, and he says, the result, at least a few years ago when we talked about it, were 50-50 accurate. Like half of the time is wrong, the results for prostate cancer test. And he said, logically, you shouldn't do it because it's like flipping a coin. It's 50-50, so you shouldn't do such a test. But at the same time, he said it's a norm. It's accepted in the medical industry. And if you don't do it and turn out that the patient does have cancer, then you're liable. In court, you will always lose. They will bring an expert, and the expert said we should do the test, and the judge will say, why didn't you do the test? And you lost, kind of thing. So like changing the paradigm into, let's say, doing diet instead of giving drugs. I mean, there is the willingness of the practitioner, but how much freedom is there? Like that the doctor can say, you know what, I'll do whatever. I don't care what other doctors said. I'll just do whatever I think is right. How much of that is there?
Yeah, I think it is. I mean, I do believe in this freedom, and I don't want to give it up. But this is what I like so much about these new concepts, because I mean, what is it that you need research for? Basically, I mean, to understand some trends, of course, research is great. Yeah? But basically, in the medical community, in the medical world, you need research for quite invasive and possibly dangerous interventions. So yeah, you can't just go and cut open a person and do some surgery without any backup from some good evidence that this will help this patient. So, and this is when I go into this kind of progressive or lifestyle medicine, yeah, where I can try to figure out, is there a real cause? I mean, are you just eating junk food all the time? And this is most probably the real cause for overweight and diabetes and all this, and we can change it. Oftentimes there is no one single cause to be seen, and then the intervention will be not to treat a single cause, but to try to bring up resilience. I mean, what are all the things I can do in order to get the patient stronger? Yeah, and there are so many things that are absolutely without any possible, I mean, yeah, harm. I mean, I can motivate them to do less Facebook and sleep more. I can motivate them to eat better. I can motivate them to do better, I mean, exercising in a reasonable way. You can also over-exercise, yeah? How to sleep better. I mean, there are so many very skillful and easy means to change. I mean, one thing I really like is, for example, play, yeah? To let the people play again, to bring joy into their life, to give them time they really use for themselves. Yeah? I mean, all these little interventions, if you combine them, can have real impact. And I do not need any research for it. There is research for all of this, yeah, like music can make better depression and yoga can make better depression. There is a lot of research, but I wouldn't need it in order to advocate these kind of changes in my patients. Yeah.
But in your research, looking at all Western medicine as much as you did you see practitioners, like this new practitioners that face the real disease, like not something general, like they have a disease and they say, you know what, do these modification, don't do the drugs, or it's always you have to do the drugs, there's the liability thing, but also do modification? Like, are there any of these who say we actually found other things instead, or it can only just be complementary?
No, there are a lot of them, and basically you have to set the patients free. Yeah, I also do. I tell them, okay, this is a conventional model. You have back pain, you get like ibuprofen, and you have a heart attack. You have had a heart attack, and you risk to get extreme high blood pressure and stroke and heart attack. Again, if you take these drugs for a longer time, this risk is real and it's documented. So I do advise against it, but this is the easy way. If you want a more complicated way, we can do acupuncture, we can do this and that. And I also, I mean, I think you have just to be honest with the patient and say, okay, I can give you a drug for your diabetes, but if you really embrace change in your lifestyle and in your diet, you may lose 20 pounds. This may better your hypertension. This may better how you feel. This may better your depression. This may better your diabetes. Yeah, so if the things you can change on your own body outweigh the effects of any drugs by 100 times, yeah. So, and you are in control of what you are changing, and it's not like I just read a nice article today of one of the I mean, really top guys of this functional medicine, that he said there is no no side effects in drugs. Yeah, drugs do get into certain pathways in the body, yeah, chemical, biological pathways in the body, and they have effects that are desired and there are effects that are not desired. Yeah, but all these effects are bound to this drug, and you can avoid all these side effects, all these effects you do not want when you change your behavior. So this is, I mean, when you explain it to the patient like this, I mean, many are willing, not all, of course.
So is this things that you find in modern medicine, which is different than the conventional drugs and procedures, is it mostly revolving like lifestyle modification, diet and sleep and exercise, or are there other new inventions or something else going on?
Yeah, this is, I think the Americans, they call it aggressive lifestyle intervention. Yeah, I really like this because it's this. Is it only lifestyle intervention? I mean, not, of course not. There are some, I mean, there are some supplements you can use, and they are quite, if you know how to use them, to use them, you can have quite some impressive results. I have a colleague not far away from here. I mean, they do like bowel testing, and when there's a bug they really don't like, they take an antibiotic. So you can, of course, combine it also. Yeah, you can see which methods I feel safe with, and then you can use them also to integrate it. But I think we really underestimate the effect that lifestyle change can have. I mean, there was a study from California where they put 13 patients with Crohn's disease and colitis ulcerosa on a paleo diet where they only ate like fresh fruits, fresh vegetables, meats, all the stuff for 11 weeks, and 10 out of 13 got into full remission. Yeah? And this is a disease that you try to control with Western drugs. And if it doesn't work, you really have to take out some of the gut, the colon, and which is a really aggressive intervention. Yeah? And so when you compare this to, I mean, saving 10 out of 13 people just by diet from these complications, I mean, it's the best it can get. Yeah? I don't see anything above this. Yeah? And there's one from Los Angeles, also a professor for neurology, and he basically had, I mean, really well documented cases of Alzheimer's disease in an early stage. He was able to reverse them. Yeah? And it's not the single pill, it's not just eating better, it's really taking all of it in. I mean, improving their diet, improving their hormonal status, improving their sleep, improving their exercise, giving them like supplements for vitamin D, for example. I mean, he really tried to increase, to take the whole patient on a whole new level by improving all the things he could think of that would have an impact on, how you call it? I'm lost here. I mean, on cognition, basically. Yeah? So I need this also. So this is quite, I mean, they are really, and you really could show that they got back to full functioning cognitive function, yeah, with only these interventions. And this is impressive. I don't need any more.
Yeah. You know, I mean, in hunyuan, we have this part of the body that includes the diet and exercise and things like that. And I think so far you mentioned a lot of that, like changing the diet and the exercise and the physical things. But we also have in hunyuan this heart issue about the heart being in harmony and happy. And so did you encounter a lot of this too? Like doctors that say use meditation or make the heart happy and that will make you healthy. Is there any of that stuff going on or not so much?
Yes, there is. I mean, this is always, I mean, yeah, for the difficult cases, yeah, I mean, there are people who are just happy and don't know what to eat. And when they change their diet, I mean, a lot of good things will happen. And of course, there are people who have a horrible diet and who change their diet and some things get better, but of course not everything. Yeah? There's one there's a guy called Rob Wolf. He is one of the top, yeah, I mean, he was one of the first to promote all this paleo stuff, and he had been invited to coach quite a wealthy person into change of behavior, change of diet, and all this stuff. And this person then really had some, how you call them? They help you in the house, some helpers at the house, yeah. Yeah. Really had them throw over some junk food over the fence so he could grab it and eat it, yeah. And in the end, he said, okay, I mean, the problem is not what you eat. The problem is some emotional longing behind this eating, yeah. And he was able to figure out that he was like left alone from his parents and had been taken off by a nanny, and she was always like trying to comfort him a lot with the food. Yeah? And he said, okay, your solution is not what to eat. Your solution is to bringing back this nurtured feeling in the heart, basically. Yeah? And he really left him. And I said, I can't help you. I mean, I can't help you with showing you what to eat when this is a real problem. So there is, of course, not one single method to get at it, but basically a lot of those people do embrace this concept of the heart having, I mean, and research does really support this idea also, yeah, that mental health and how you feel, how you interact with the world has a huge impact on the body also, of course.
So how do you, I mean, did you see any way that people reconcile the fact? Because some of the things that you're saying is some doctors found out that if you change the diet, change the lifestyle, it actually can resolve a lot of problems. And yet many other doctors that would use drugs and procedure potentially are harmful in order to address the same problem. So how do they reconcile it? Because the one that say change your diet obviously is a much happier thing. It's harder to make money from, but it's much better on all counts for the patient. So if some doctor could get to this result just by changing the diet, another doctor give them drugs with side effect procedures, surgeries that could also help but make some problem, and it's part of it is about money. Like, how do they reconcile it? I mean, is there like, well, these ones are right, these ones are wrong, or these ones are sham, we are the real medicine? Is there any of that,
I mean,
stuff?
basically, I think um, the conventional Western medical paradigm and way of treating disease has its merit in acute medicine. I mean, if I have a trauma of my leg and it's broken in 100 pieces, I will do acupuncture for the pain, but it's not my only option. Yeah? So I will go to find a specialist who really can do surgery and all this. And if you end up in a hospital with a stroke or with a heart attack, it's even better. Yeah, you can do this coronary angiography and you can really save people's life. And this is of course great. I mean, but we should really try to see where I mean, let's everybody do where he's good at. And Western medicine is good at treating acute conditions, yeah, and but really miserably fails at treating chronic conditions, because this model of I have one disease with one course, or even better with one cure. I mean, this would be. I mean, I would prescribe these drugs all day long, really happy if it would work like this, yeah, but it does not. I mean, there was a study published showing how many often used drugs have depression as a side effect. Yeah? I mean, it's ibuprofen and pantosol, omeprazole, of this proton pump inhibitors. I mean, so many really commonly used drugs have so huge side effects in the long term, which nobody wanted to look at, because, of course, instead of removing the stomach from a stomach ulcer, proton pump inhibitor is a great drug, of course, yeah. But if you give it like Smarties to everybody, on the long term, you will see side effects in all the systems of the body. Yeah? So I think this is what we should aim for, to really see, okay, where's everybody strong and good at, and yeah, tell the people to go there with a heart attack. Of course, I send my patients to the hospital if I think this is a problem, but on the other hand, I really try to keep them in my clinic and let them not go to any specialist who will prescribe really hard drugs and intervention for a problem I think I can solve better with lifestyle change.
Let me ask you that. I mean, maybe it's a little lengthy questions, but see if you can find an answer to that. Like when I, visited pediatrician in regards to vaccines, which is not the topic of the talk here at all, but I met one older pediatrician. He was about to retire. He was pediatrician for like 50 years, and he's now like 70, and he's retiring in 2 months. And I remember having that conversation with him, and he says, yeah, 50 years ago, there were much less than now, the regimen of vaccines and this. And I remember him telling me, I'm not the vaccine police. Like, if you think people shouldn't do it, they shouldn't do it. Yeah, like he was more careless about it because he's retiring in 2 months. But then I met other pediatricians who just came out of med school, and they're like, look, if you're not doing vaccines, we don't want anything to do with you. It's bad medicine. We don't want, like very more martial in a way that this is how we learn. That's what's allowed. That's what should be. And the question that I have for you here, not related to vaccines at all, but rather these many kind of procedures, some of them are, you have to do it because that's the industry standard or that's the law. And there's not so much freedom for any practitioner to really do whatever they want. They can do some things, like some this, but they can't do whatever they want. There's some standards that they have to follow. How much did you see from your research that there's actually like, grassroots movement, or like the people are demanding something else that make the doctors conform, or is any of that there? like that really people now are awakening and they said, I want something more holistic, I don't want procedure, I want drugs. And then the doctors kind of conform to it or try to invent for it or cater for it. Like how much of this exists, or does it exist at all? Is, you know, I used that vaccine kind of example, but I hope you're still there. Your picture on Facebook look a little frozen. Did you, okay, I see you on the other screen, but did your phone die? Let's just wait for a moment for Dr. Hoelscher. Just 1 second. So what happened?
Just a second.
Okay, we're just waiting for Dr. Hoelscher for a moment. Maybe his phone died, maybe he just needs a charger for the Facebook stream. So just take a break for a moment. Drink a cup of tea. If it's hot where you are, drink iced tea. If it's cold, drink some hot tea. Let's just see. So what happened?
Yeah, it's but I'm in the doctor's office, so like I said.
Okay. Some doctors are summoning you.
Yeah. So it should work. Let's have a look.
Just 1 second. We'll
You
just
stopped
have...
it? You stopped the Facebook?
I am on Facebook, but I don't see you on Facebook. Can you join to the Facebook again? Where are you? Just be patient with us. There's just too much emotions going on in this stream, so the Facebook stream just blew up.
Okay.
Do you have the Facebook stream?
Facebook stream.
I don't see you.
I'm there. I sent you an invitation
I'm
before.
on your page, but I know.
So anybody in the crowd can invite Dr. Hoelscher to join us. I can't hear viewers. Bastian.
Sure. Join us.
I can't send you the invitation again. Facebook doesn't like what you're saying.
Yeah.
Okay.
Facebook.
So it's not on our page.
Yeah, I said useless Facebook.
Let's see. So you're not here. So just try to look for it. It's not on my page, on any of the pages, Institute or
Not here.
personal page.
Just to
Oh boy. I think Facebook is upset.
Ah, sorry. Okay, I see.
You see it?
Yeah, now I go.
Okay.
Okay.
Alright, perfect. So now I got you in.
Okay, sorry.
No problem. So Dr. Hoelscher is back. We overcome all the resistance from Facebook. So I was just asking you if you see like a grassroots that people want something else, and that's what makes some doctors look for other options, or is it anything else, like doctor by themselves come out with this? Or what's your opinion?
Yeah, basically, I think the change will have to come from the patients. Yeah, because the change will have to come from the patients because. I mean, at least in Germany, you study for 6 years and you go to be a specialist. It takes you another 6 years. So you have been like 12 years in the system. And it's really hard to break out. I mean, the best thing is to get sick, yeah, and not being cured by Western medicine. This is my own experience, yeah. But yeah, so I mean, those physicians, they are a bit humble, and they will look. I mean, you are just in this. If you work for 12 years in the system and you communicate only with people in the system, and all the solutions they provide you are within the system, and everything that is with outside of these borders is like, yeah, it's a nice try. I mean, you can try it, and if it helps, it's great. But I would never consider telling any patient of this. Then it's very hard to break out. So I think the change has to come from the patients, and I think it is coming. I mean, you have all those. I mean, you have those Facebook groups concerning all these special diets for the special ailments, and they are overloaded. Yeah, I once said, okay, I'm a physician. I would like to have some information for a patient with a special disease where I was not sure whether diet could help, and the crowd was really like, oh, great, there's a physician interested in this. They were really like, they couldn't believe it. So it's not coming from the physicians. It has to come from the patients. I'm quite sure about this.
So I think this is beautiful and right on. So maybe just to wrap it up and conclude this short interview and very useful talk that you gave, if there are patients watching this, like what would you recommend for them, the next step? Like how do they go about extricating themselves out of the system? How do they go to other things?
Yeah, the big problem always is, I mean, I've been listening and reading up to 20 books on the subject and in the last year, and there's always this disclaimer going on, like, okay, if you really want to, if you are on a medication like this and the other, you really want to try it out, go talk to your physician. And this is a big problem because, I mean, there are so many options out there. Also, I don't know all the treatment protocols going on, so I can't, of course, comment to everything. But I think, yeah, basically educate yourself, yeah, and don't read one book on nutrition. Read, if you can, like 5, yeah, and try to see where's the middle ground, yeah. And there are, of course, due to the internet, there are a lot of options on Facebook groups and all this where people with a similar disease, I mean, really share their information. And this is nothing new. You have the self-help groups in the offline world, of course, also. And one has to be honest that those people who are really suffering from a certain disease and who climbed out of it are experts often, not all of them, but many of them are really experts on this field, much more than any physician could be, yeah? Because they have the disease, they have really the desire to overcome it, they seek out all this stuff that is there, and they try it out themselves. Yeah? So this is, I mean, I tried out quite a lot from the nutritional point, so I have some experience with it, but I mean, this I would advise, of course.
I actually had a patient that I told her that I said she has all kind of complicated thing going on, and I said, look, when you're healed from that, you're going to be the expert on this. Nobody else will be able to, more than you.
Yeah, exactly. Yeah.
In other words, when the patients learn how to heal in all different ways and they overcome their problem, they become the experts instead of out of medical school. The patients become the experts, and that's pretty cool, I think.
Yeah, I really like this idea that I mean, this is what very often drives people. Yeah? You have a problem at some point of your life and you really overcome it, and out of this comes a motivation to share it with others. Yeah? And this is what a lot of people who have those blogs and write those books have behind. There's the wish to help others with the same problem. And this is quite pure. Yeah? I mean, you write a book, you sell it for $10. I mean, this is quite pure, and I really like the motivation from a lot of people behind this.
Yeah, I think for us in Hunyuan, this is called the Tao heart. You know, if you help yourself and you realize you overcome it, you did it, and just because of that, you want to share with others and help them. That's what you call so pure. This is, I think, the most beautiful realm we can find ourselves in. You know, but I think this was great. We can just keep on talking forever, and Facebook will keep on trying to block us from spreading the news. But thank you very much, Dr. Hoelscher, for doing it with me today. If anyone watching it enjoyed it, just share it with your friends, with your groups. This will be a great help. And it was very interesting for me to find out that, you know, we're not alone in this drive to change the face of medicine, but many other people are trying to do the same.
Yes. Yeah, thank you for having me. Thank you.
All right, thanks everyone. Bye-bye.
Bye.